Nyla sprinted through Presbyterian Medical Center's polished marble lobby, weaved past 3 security guards, ducked under the reception counter, and burst through the ICU doors where a $2 million medical team had just declared 16-year-old David Wilson's case hopeless. "Stop the treatment! You're killing him!" the barefoot 12-year-old shouted, snatching the patient chart from Dr. Victoria Sterling's hands. "This isn't brain death, it's locked-in syndrome, and you've been medicating him wrong for 2 weeks." The Yale-educated neurologist scoffed until Nyla pointed to 3 symptoms every specialist had overlooked. Symptoms she'd memorized from a damaged medical textbook she'd been carrying since her brother died from the exact same misdiagnosis 3 years ago. What happened next didn't just save David's life. It exposed the arrogance of an entire medical establishment and proved that knowledge doesn't require credentials, just the courage to see what others refuse to acknowledge. Nyla hadn't eaten in 2 days when she made that desperate dash through the hospital, but she carried something more valuable than any medical degree: the truth that everyone else was too proud to see. This is the story of how a homeless girl with dirt under her fingernails diagnosed what million-dollar doctors couldn't, and why you'll never look at medical expertise the same way again. The towering glass facade of Presbyterian Medical Center reflected the afternoon sun across Philadelphia's medical district, its pristine surfaces hiding the life-and-death struggles playing out within its walls. This wasn't just any hospital. It was where the nation's wealthiest families sent their loved ones when money was no object and only the absolute best would suffice. Dr. Victoria Sterling stood in the center of the neurological ICU's most expensive suite, surrounded by equipment that cost more than most people's homes. The machines hummed with technological precision, monitoring every vital sign of the motionless figure lying in the hospital bed. For 2 weeks, these million-dollar monitors had told the same devastating story. David Wilson, 16 years old, was dying, and the most brilliant medical minds money could buy had no idea why. "The brain scans remain unchanged," Dr. Sterling announced to her assembled team of international specialists, her voice carrying the authority of someone who had never been wrong about a neurological diagnosis. Complete unresponsiveness to all stimuli, no eye movement, no voluntary muscle control, no indication of consciousness. Her team represented the pinnacle of medical education and expertise. Dr. Richard Hayes from Johns Hopkins, whose research on comatose states had revolutionized American medicine. Dr. Catherine Mueller from the Mayo Clinic, flown in specifically because her diagnostic abilities were considered legendary. Dr. James Morrison from Stanford, whose neurological assessment techniques were taught in medical schools worldwide. Together, they had cost the Wilson family over $300,000 in consultation fees. Together, they had run every test known to modern medicine. Together, they had failed completely. "We need to have the conversation," Dr. Sterling continued, her tone clinical and detached. "The family has been asking about experimental treatments, alternative approaches, miracle cures. It's time to prepare them for end-of-life decisions." Outside the suite, Sarah Wilson pressed her trembling hand against the window, watching the team of doctors discuss her son's fate with the same emotional investment they might show toward a broken piece of equipment. For 2 weeks she had watched David, her brilliant, athletic, college-bound son, lie motionless while machines breathed for him, and experts spoke in medical terminology she couldn't understand. But their expressions told her everything she needed to know. They were giving up. That's when she noticed the small figure at the end of the hallway. A girl, maybe 12 years old, stood perfectly still among the controlled chaos of the ICU. Her clothes were too large, held together with safety pins and determination. Her sneakers had holes worn through the soles. Her hair was pulled back with a rubber band, and her face carried the kind of grime that came from sleeping outside. But her eyes, sharp, focused, and strangely purposeful, were fixed on the medical team with an intensity that made Sarah's breath catch. The girl clutched something against her chest, a medical textbook so damaged it was held together with duct tape, its pages yellowed and torn, covered in handwritten notes that filled every margin. "Excuse me," the girl said softly, approaching Sarah with careful steps. "Is that your son in there?" Sarah blinked, startled by the question. Yes. How did you know?" "Because I can help him." The words hung in the sterile air like an impossibility. This child, this homeless girl with no shoes that fit, and a textbook that looked like it had been rescued from a dumpster, was claiming she could do what teams of world-renowned specialists couldn't. "What did you say?" Sarah whispered. The girl's grip tightened on her book. "Your son. The doctors think he's brain-dead, but he's not. They're treating the wrong condition, and every day they continue, they're pushing him closer to actual death." Before Sarah could respond, Dr. Sterling's voice cut through the hallway like a surgical instrument. "Security, there's an unauthorized individual in the ICU." Two guards appeared immediately, their hands reaching for the girl's shoulders. But Sarah Wilson, driven by a mother's desperation and the first spark of hope she'd felt in 14 days, stepped between them. "Wait," she said firmly. "I want to hear what she has to say." The confrontation that followed would expose truths that threatened everything Presbyterian Medical Center believed about expertise, authority, and the practice of medicine itself. Nyla Carter had been 12 years old for exactly 3 months when she learned that knowledge could be more dangerous than ignorance and infinitely more lonely. She had been living on the streets of Philadelphia for 2 years now, ever since the night that had changed everything, and she had discovered that while hunger could be endured and cold could be survived, watching people die from preventable mistakes was a pain that carved itself into your soul. Her shelter beneath the Benjamin Franklin Bridge was a carefully constructed sanctuary of cardboard, plastic sheeting, and salvaged materials. But the real treasure wasn't the protection from Philadelphia's harsh winters. It was the collection of medical textbooks she had rescued from dumpsters behind University of Pennsylvania's medical school, books that graduating students had discarded, books that had become Nyla's entire universe. Robbins and Cotran, Pathologic Basis of Disease, 10th edition. Harrison's Principles of Internal Medicine, 21st edition. Gray's Anatomy for Students, 4th edition. Each book was damaged, missing chapters, stained with coffee and tears from their previous owners. But to Nyla, they were perfect. She had read each one multiple times, memorizing entire sections, filling the margins with her own observations and cross-references that created connections most medical students never discovered. The other homeless individuals in the Bridge community called her Doc Girl, and they had learned to trust her medical insights completely. When respiratory infections threatened the camps during Philadelphia's brutal winters, Nyla could identify pneumonia symptoms days before they became critical and direct people to the emergency rooms most likely to provide care. When diabetes complications arose among the older residents, she knew which clinics offered free medication and which doctors would treat homeless patients with dignity. Her reputation had spread through the invisible network of Philadelphia's forgotten population, and people traveled from other neighborhoods specifically to seek her advice. But Nyla's medical knowledge wasn't just academic. It was forged in the fires of personal tragedy. 2 years ago, she had a brother, Ethan Carter, age 14, the most brilliant person she had ever known. He had been complaining of severe headaches, episodes of confusion, moments where he would suddenly become completely unresponsive for minutes at a time. Their foster parents had assumed it was teenage rebellion. The school counselor had suggested it was attention-seeking behavior. Even the emergency room doctor, during their single visit, had diagnosed adolescent stress syndrome and sent him home with instructions to get more sleep and avoid caffeine. Nyla had known something was catastrophically wrong. She had noticed the way Ethan's eyes would track movement during his unresponsive episodes, the way his breathing would change in patterns that seemed too purposeful to be unconscious reflexes. She had tried to document these observations, had begged the adults to listen, but who takes medical advice from a 10-year-old girl from the foster system? The night Ethan died, officially from what the medical examiner labeled sudden unexplained neurological event, Nyla had broken into the University of Pennsylvania's medical library. She had sat on the floor between the stacks for 8 hours straight, reading everything she could find about consciousness, comas, locked-in syndrome, and the 1,000 ways the brain could be injured without showing obvious external symptoms. She had learned that Ethan hadn't been unconscious during those episodes. He had been trapped inside his own body, aware but unable to communicate, probably terrified and desperate for someone to understand what was happening to him. The condition that could have saved her brother's life was clearly described in those textbooks. The diagnostic markers were well established. The treatment was straightforward and highly effective. But nobody had thought to look, because nobody had taken a 10-year-old's observations seriously. That night, Nyla had made 2 life-altering decisions. First, She would never again live in a system that had failed her brother so completely. Second, she would master every piece of medical knowledge those textbooks contained, so that what happened to Ethan would never happen to anyone else if she had the power to prevent it. Now standing in the gleaming hallway of Presbyterian Medical Center, Nyla recognized the exact same symptoms she had memorized during those sleepless nights, reading by stolen flashlight. David Wilson wasn't brain dead. He wasn't in an irreversible coma. He was locked inside his own body, probably terrified, probably aware of every conversation the doctors were having about ending his life. The medical team's approach wasn't just wrong. It was slowly killing him. Every day they continued with their current treatment protocol, they were suppressing the exact neural activity David needed to communicate and recover. But Nyla knew the pathway back to consciousness. She had studied it every night for 2 years, waiting for a chance to save the brother she had lost. She clutched her damaged textbook tighter and prepared to challenge the most expensive medical team in Philadelphia. Dr. Victoria Sterling approached the confrontation with the controlled precision that had made her one of the most feared and respected neurologists on the East Coast. Her custom Italian heels clicked against the polished marble floor with mechanical regularity as she surveyed the scene. A homeless child disrupting her ICU, a distraught mother enabling the disruption, and 2 security guards waiting for her command to restore order. "Mrs. Wilson, Doctor," Sterling said, her voice carrying the particular tone she reserved for managing difficult family situations. "I understand that grief can make even the most impossible possibilities seem reasonable, but allowing unauthorized individuals into our ICU is both against hospital policy and potentially dangerous for your son." Sarah Wilson held her ground, her arm still protectively extended between the security guards and Nyla. "Dr. Sterling, this girl says she knows what's wrong with David. She says you've been treating the wrong condition for 2 weeks. Dr. Sterling's laugh was sharp and clinical, the sound of someone who had never been contradicted by anyone without multiple medical degrees. "Mrs. Wilson, I appreciate that desperation can distort judgment, but this child has no medical training, no credentials, no possible way of understanding your son's complex neurological condition. My team represents over 70 years of combined experience in neurological medicine. We've consulted with specialists from Harvard, Johns Hopkins, Stanford, and the Mayo Clinic. We've conducted every diagnostic test known to modern medicine." Nyla stepped forward, her torn textbook pressed against her chest like armor. "You conducted the wrong tests." The statement hung in the sterile air like a physical challenge. "Doctor," Sterling's eyes narrowed as she studied this impossible child who dared to contradict not just her professional judgment, but the entire hierarchy of medical authority. "Excuse me?" "Locked-in syndrome presents differently in adolescence," Nyla said, her voice steady despite the tremor in her hands. "The neural pathways are still developing, so the classic eye movement responses don't appear immediately. You've been testing for consciousness using adult diagnostic parameters, but David's brain is fighting the condition in ways your standard protocols don't recognize." "Doctor," Sterling felt something she hadn't experienced in over 20 years of practice, genuine uncertainty. Not because she believed this homeless child, but because the girl's words carried a level of medical specificity that shouldn't have been possible. "Where exactly did you acquire this information?" Nyla opened her damaged textbook to a page covered in her own handwritten notes and cross-references. Dr. Elena Vasquez's research from 2019, published in the Journal of Adolescent Neurological Medicine. She documented 23 cases of atypical locked-in syndrome in patients aged 13-18. The diagnostic markers are completely different from adult presentations, but most neurologists don't know about her work because it appeared in a specialty journal that isn't widely read. Dr. Sterling's confidence wavered. She did know about Vasquez's research. It had been controversial, largely dismissed by mainstream neurological associations, and yes, it had been published in a journal she didn't regularly review. "Dr. Sterling," Dr. Hayes interrupted, approaching with the latest EEG results. "We're seeing some unusual wave patterns that don't fit our current diagnosis. There are theta wave fluctuations that seem inconsistent with brain death." "What kind of fluctuations?" Nyla asked before Dr. Sterling could respond. Dr. Hayes blinked, apparently noticing the girl for the first time. "I'm sorry, who is this person?" Show me the patterns, Nyla pressed, ignoring the question. If they're theta waves in the 4-7 Hz range, with intermittent gamma spikes above 30 Hz, that's not brain death. That's a conscious mind trying to break through neurological interference. Dr. Sterling snatched the EEG printout from Dr. Hayes's hands, her eyes scanning the data with growing alarm. The wave patterns matched exactly what the girl had described. "This is impossible," she whispered. "No," Nyla said quietly. "It's just uncommon. And if you continue treating David for brain death instead of locked-in syndrome, those neural patterns are going to disappear permanently. The sedative medications you're administering are suppressing the exact brain activity he needs to recover consciousness." For the first time in her distinguished career, Dr. Victoria Sterling found herself confronting a possibility that threatened everything she believed about medical expertise. That this dirty, homeless child might possess knowledge that she and her team of internationally renowned specialists lacked. And if the girl was correct, they had been slowly killing their patient for 2 weeks. The implications were staggering, not just for David Wilson's life, but for the entire foundation of medical authority that Dr. Sterling had built her career upon. But what happened next would prove that sometimes the most important medical breakthroughs come not from expensive equipment or prestigious degrees, but from someone who understands suffering deeply enough to recognize it in others. The neurological ICU fell into a silence so profound that the mechanical breathing of ventilators seemed unnaturally loud. Dr. Sterling stared at the EEG readout in her hands, her mind racing through the catastrophic implications of what Nyla had just revealed. Around her, the assembled medical team, specialists who had been flown in from the most prestigious institutions in the country, waited for her response, with expressions ranging from confusion to barely concealed panic. "This is absolutely absurd," Dr. Sterling finally said, but her voice lacked its usual commanding authority. "You're asking me to completely reconsider a diagnosis that has been confirmed by 4 independent neurological specialists based on the observations of a child who has no medical degree, no hospital privileges, no credentials whatsoever." Nyla moved closer to David's bedside, her bare feet silent against the cold floor. "I'm asking you to consider that credentials aren't the only path to understanding medicine. Sometimes the most important insights come from paying attention instead of just following established protocols." "Following established protocols," Dr. Sterling snapped, her professional composure cracking, "is what separates real medicine from dangerous guesswork. It's what protects patients from..." "From what?" Nyla interrupted, her young voice carrying an edge of pain that cut through Dr. Sterling's defensive anger. "From people like me? From someone who actually listens to what patients are trying to communicate?" Sarah Wilson watched the exchange with a mixture of hope and terror building in her chest. This 12-year-old girl was challenging one of Philadelphia's most powerful doctors, and she could see Dr. Sterling's anger escalating. But she could also see something else in the doctor's expression: doubt. "Dr. Sterling," Dr. Muller spoke hesitantly, "perhaps we should at least consider the possibility..." "Consider what?" Dr. Sterling's voice rose, echoing off the sterile walls. "Abandoning 25 years of neurological practice because a homeless child claims to have read something in a damaged textbook. Do you understand what you're suggesting? That our entire diagnostic process, our years of medical education, our internationally recognized expertise, all of it is worthless compared to the theories of a girl who lives under a bridge." Nyla's grip tightened on her textbook, and for a moment her carefully maintained composure wavered. "The worthless theories already killed my brother." The words fell like stones into still water, creating ripples of uncomfortable silence that spread through the gathered medical professionals. Dr. Sterling's expression shifted as some of her anger was replaced by reluctant curiosity. "Your brother, Ethan Carter, 14 years old, died 2 years ago from what the medical examiner called sudden unexplained neurological collapse." Nyla's voice remained steady, but her eyes carried the weight of unhealed grief. "He had the same symptoms as David. The same EEG patterns you're seeing, the same theta wave fluctuations, and the doctors did exactly what you're doing. They followed standard protocols instead of listening to what his condition was actually telling them." Dr. Sterling felt something cold and uncomfortable settling in her stomach. "What are you suggesting?" I'm suggesting that if one doctor had taken 10 minutes to consider that a 14-year-old's brain might respond to trauma differently than an adult's, my brother would still be alive. Nyla looked directly at Dr. B. Sterling, her young face carrying knowledge that no child should possess. And I'm suggesting that if you don't immediately discontinue the sedative protocol and start treating David for atypical locked-in syndrome, you're going to kill him using the exact same medical ignorance that killed Ethan. The accusation hung in the air like a physical presence. Dr. Sterling felt the weight of her entire team's attention, felt the foundations of her professional identity trembling beneath the challenge posed by this impossible child. You're asking me to risk my patient's life on the medical opinion of a 12-year-old homeless girl? No, Nyla said quietly, opening her textbook to a page covered in detailed treatment protocols. I'm asking you to risk your pride to save his life. Dr. Sterling stared at the girl for a long moment, then at the EEG readout that contradicted everything she had believed about David's condition, then at the hospital bed where a 16-year-old boy lay connected to machines that might be slowly ending his life instead of preserving it. The next decision would either validate everything she had built her career upon or force her to confront the possibility that medical expertise could come from sources she had never imagined. If I give you 10 minutes to demonstrate your assessment, she said slowly, her voice tight with tension, and if your evaluation proves incorrect, I'll have you arrested for interfering with medical treatment and endangering a patient's life. Nyla nodded without hesitation. And if I'm right about David's condition? Dr. Sterling's jaw tightened as she realized she was about to stake her entire professional reputation on the outcome of the next few minutes. If you're right, then everything I've believed about the practice of medicine will need to be reconsidered. Then let's find out who's been paying attention, Nyla said, approaching David's bedside with a reverence that none of the expensive specialists had shown. The room held its collective breath as a homeless girl prepared to either save a life or destroy her own credibility in front of the most prestigious medical team in Philadelphia. What happened next would change everything. News of the unprecedented confrontation spread through Presbyterian Medical Center's corridors like electricity through copper wire. Nurses paused in their rounds, residents gathered in small clusters, and hospital administrators watched from observation windows as the most expensive medical consultation in the hospital's history was challenged by a 12-year-old girl with holes in her shoes. Nurse Jennifer Martinez, who had worked the neurological ICU for 12 years, stood outside David's room with her arms crossed, shaking her head in disbelief. "This is the most ridiculous thing I've ever witnessed," she muttered to her colleague. "That child probably doesn't even know how to read an EEG properly." But even as she spoke, Jennifer remembered something that had been troubling her during her night shifts. When the room was quiet and David's family had gone home to rest, she had noticed subtle responses that didn't appear on any monitors. Small changes in breathing pattern when voices carried from the hallway. Almost imperceptible facial muscle movements when certain music played on the radio. Tiny variations in heart rate that seemed to correlate with environmental stimuli. She had mentioned these observations to Dr. Sterling once, but the neurologist had dismissed them as post-trauma reflexes and meaningless neural static. Now watching Nyla approach David's bedside with a level of focused attention that none of the million-dollar specialists had demonstrated, Jennifer found herself wondering if those subtle responses had been meaningless after all. In the family waiting area, word of the unusual situation had reached other families maintaining their own vigils. Robert Chen, whose daughter was recovering from spinal surgery 3 rooms away, shook his head in amazement. They're actually letting a street kid examine patients. What's next, having maintenance workers perform brain surgery? But David's aunt, who had driven down from New York that morning, watched through the observation window with growing fascination. "Look at how she's studying him," she whispered to Sarah. "She's not just looking at the machines like the doctors do, she's actually looking at David." It was true. While Dr. Sterling's team had spent 2 weeks focused on monitors, readouts, and test results, Nyla was studying David himself. She moved slowly around his bed, observing him from different angles, her eyes tracking details that escaped clinical observation. In the hospital's administrative offices, news of the medical standoff had reached Dr. Patricia Morrison, Presbyterian's chief of staff. She stood at her office window overlooking the ICU wing, phone in hand, debating whether to intervene before this circus damaged the hospital's carefully cultivated reputation. "Ma'am," her assistant said nervously, "Dr. Sterling's consultation team represents over $400,000 in fees. If this homeless child somehow undermines their professional assessment—" Dr. Morrison nodded grimly. Presbyterian Medical Center's reputation was built on providing the highest level of medical care available anywhere in the world. They attracted the most brilliant minds, charged premium rates, and delivered results that justified their astronomical costs. A homeless girl succeeding where internationally renowned specialists had failed would raise uncomfortable questions about the relationship between expensive medical care and effective medical care. But even as she considered ending the examination, Dr. Morrison found herself curious about the outcome. In 30 years of hospital administration, she had witnessed medical miracles, but she had also observed medical arrogance. Sometimes the most expensive diagnosis wasn't the most accurate one. Back in David's room, the tension was suffocating. Nyla knelt beside the bed, her damaged textbook open to a page filled with handwritten notes and treatment protocols. She began speaking in a low, gentle voice, not to the assembled medical team, but directly to David. "Hi, David. My name is Nyla. I know you can hear me even though everyone else thinks you can't. I know you're trapped inside your body right now, and I know you're scared. But I want you to understand that someone finally recognizes what's really happening to you." "Doctor," Sterling started to interrupt. Talking to comatose patients was considered therapeutic but ultimately meaningless, but something made her hesitate. David's heart rate monitor was showing a slight but measurable increase in rhythm. Nyla continued, her voice calm and reassuring. "I'm going to ask you to do something very simple, David. If you can hear me and understand what I'm saying, I want you to try to blink twice. Don't worry if it's difficult or if it doesn't work perfectly. Your brain is fighting through a lot of interference right now, but I believe you can do this." The room fell into absolute silence. 14 pairs of medically trained eyes focused on David's closed eyelids, waiting for a response that would either validate or destroy everything they believed about his condition. Seconds passed like hours. "Doctor." Sterling held her breath. Sarah Wilson gripped her sister's hand so tightly her knuckles went white. The heart monitor continued its steady beeping, slightly faster than it had been moments before. And then, slowly and deliberately, David Wilson blinked twice. If there's anyone watching who believes David should have the chance to recover, type hope in the comments below. The 2 deliberate blinks sent shockwaves through David's room that would ripple far beyond Presbyterian Medical Center. Dr. Sterling stumbled backward, her face drained of color, while Dr. Hayes grabbed the nearest chair for support. Every monitor in the room showed clear physiological responses, increases in heart rate, blood pressure, and neural activity that should have been impossible in a brain-dead patient. That was voluntary, purposeful movement," Dr. Muller whispered, her voice barely audible above the mechanical hum of life support equipment. Nyla remained calm, her hand gently resting on David's arm. "David, you're doing incredibly well. Can you try to squeeze my hand now, just a little pressure to show these doctors that you understand what's happening?" The squeeze came immediately, so subtle that only Nyla felt it, but unmistakably deliberate. "He's conscious," she said simply, turning to face the stunned medical team. "He's been conscious this entire time, trapped inside a body that stopped responding normally to his mental commands. Every conversation you've had about ending life support, every medical decision you've made without his input, David has heard all of it." Sarah Wilson collapsed into the beside chair, tears streaming down her face, as 2 weeks of unbearable grief transformed into overwhelming relief. For 14 days she had talked to her son about everything: his upcoming senior year, college applications, the girl he had been planning to ask to prom, never knowing that David had been listening to every word, understanding everything, unable to respond. Dr. Sterling found her voice, though it came out as barely more than a whisper. "How did you know? How could you possibly have identified what our entire team missed?" Nyla's expression grew distant, and for a moment the professional composure she had maintained throughout the confrontation cracked, revealing the grief-stricken 12-year-old underneath. "Because I watched my brother die from exactly the same medical mistake." She opened her worn textbook to a page near the back where a photograph was carefully taped to the margin. The picture showed a young boy with Nyla's eyes and smile, his arm around a smaller girl who was unmistakably Nyla at age 10. Ethan Carter. He started having episodes when he was 13. Moments where he would just disappear. His eyes would go blank, his body would stop responding. But something about those episodes felt different from regular unconsciousness. During the worst ones, I noticed his eyes would track movement, like he was trying to follow what was happening around him. Nyla's voice grew stronger as she continued, drawn back into memories she had relived countless times. The doctor said it was adolescent stress disorder, maybe some kind of psychological breakdown. Even when the episodes got longer, even when he stopped responding to voices or touch, they kept insisting it was mental health related. What happened to him? Doctor, Sterling asked, though her medical training already suggested the tragic answer. He had an episode that lasted 4 days. The doctors said he was in a catatonic state, that it was a severe psychological crisis. They put him on heavy sedatives to stabilize his system and reduce neural stress. Nyla's hands trembled slightly as she turned pages in her textbook, revealing sections filled with meticulous notes written in a child's careful handwriting. Those sedatives suppressed the exact neural pathways Ethan needed to break through the locked-in condition. Instead of helping him communicate with us, they pushed him deeper into neurological shutdown. The room remained silent, except for David's monitors, which were now showing patterns of awareness instead of the flat, lifeless readings they had displayed for 2 weeks. After Ethan died, I broke into every medical library I could find. I read everything about consciousness, about comas, about locked-in syndrome and atypical presentations. I learned that the doctors had been catastrophically wrong about everything. Nyla looked up at Dr. Sterling with eyes that carried far too much medical knowledge for someone her age. Ethan wasn't mentally ill. He wasn't catatonic. He had atypical locked-in syndrome, probably caused by a viral infection that created inflammation in his brainstem. And the treatment? Doctor, Sterling asked, though she suspected she already knew the answer. Simple and straightforward. Anti-inflammatory medication to reduce brainstem swelling, combined with specific neural stimulation exercises to re-establish normal communication pathways. The success rate is over 95% when the condition is identified early. Nyla's voice carried the weight of 2 years spent studying the cure that could have saved her brother's life. The treatment protocols have been established for over a decade. They were described in every major neurological textbook. But nobody thought to look because nobody believed that a 10-year-old girl's observations about her brother's condition could be medically relevant. Doctor. Sterling stared at David, whose breathing had become more natural, whose facial expression seemed more peaceful since Nyla had begun communicating with him. You're telling us that we've been slowly killing him for 2 weeks. Yes, Nyla said without hesitation, but David is still recoverable. The neural damage isn't permanent yet. The question is whether you're willing to admit that your diagnosis was wrong and implement the correct treatment protocol immediately. Dr. Sterling felt her entire worldview shifting beneath her feet. For 25 years, she had been the ultimate authority on complex neurological cases, the doctor that other doctors consulted when situations seemed hopeless. Her reputation had been built on precision, confidence, and an absolute belief in the superiority of institutional medical knowledge. Now a homeless 12-year-old was demonstrating that everything she had believed about this case was not just incorrect, but potentially lethal. The next words out of her mouth would either begin David's recovery or end her medical career. Dr. Sterling's world collapsed and rebuilt itself in the space of a single heartbeat. For 25 years, she had operated under the assumption that medical expertise was synonymous with expensive education, that institutional authority guaranteed diagnostic accuracy, that prestigious credentials were the only reliable path to understanding complex medical conditions. Nyla Carter had just proven every one of those assumptions devastatingly wrong. "This is impossible," Dr. Sterling said, but even as the words left her mouth, she knew they weren't true. "You're asking me to believe that a homeless child with no formal medical training has identified a condition that escaped the attention of specialists from Yale, Johns Hopkins, Stanford, and the Mayo Clinic." Nyla looked at her with steady, unflinching eyes. "I'm asking you to believe that sometimes understanding comes from experience rather than credentials. That sometimes the most important medical insights come from people who have lived through diagnostic failures, rather than people who have studied theoretical successes. Doctor, Sterling felt her professional authority crumbling like sand through her fingers. Around the room, she could see doubt creeping into the expressions of her carefully assembled team. Doctor. Hayes was reviewing his own notes with new uncertainty. Dr. Muller was studying David's face with fresh attention, looking for signs she had previously dismissed. Doctor. Morrison was quietly checking the medication protocols they had been following, comparing them against treatment guidelines he was pulling up on his tablet. Dr. Sterling. Doctor. Hayes spoke hesitantly. Perhaps we should consider running additional diagnostic tests, if there's even a remote possibility that we've misunderstood the patient's condition. A possibility based on what? Doctor. Sterling interrupted, her voice rising as her professional composure began to crack. The medical opinion of a street child who learned neurology from damaged textbooks? Do you understand what you're suggesting? That our entire diagnostic process, our decades of combined education, our internationally recognized expertise, all of it is worthless compared to the theories of a girl who lives under a bridge? But even as she spoke, Dr. Mime, Sterling was remembering inconsistencies she had dismissed over the past 2 weeks. David's EEG patterns that didn't quite match standard brain death presentations. The way his vital signs would sometimes fluctuate without apparent medical cause. The nursing staff's reports of subtle responses that the sophisticated monitoring equipment hadn't detected. Nyla moved closer to David's bedside, her voice remaining calm despite the tension that was filling the room like a toxic gas. David, I know this is frightening, but these doctors need to understand that you're still conscious, still aware, still fighting to communicate with them. Can you try to move your right index finger? Just the smallest movement you can manage, Doctor. Sterling was about to protest that voluntary finger movement was medically impossible in David's diagnosed condition when she saw it, the faintest twitch of David's right index finger. Did everyone see that? Sarah Wilson gasped, pointing at her son's hand with trembling excitement. Involuntary muscle spasm, Dr. Sterling said quickly, but her voice was shaking. Random neural firing. It doesn't indicate consciousness or purposeful movement. David, Nyla continued, ignoring Dr. Sterling's explanation, can you do that again? Move your finger one more time to show these doctors that you understand what we're asking. The finger moved again, this time more deliberately and with greater control. Doctor. Hayes stepped forward, his face pale with the implications of what he was witnessing. Victoria, that's not random neural activity. That's responsive, purposeful movement. Doctor. Sterling felt panic rising in her chest like floodwater. If Nyla was correct about David's condition, if he had been conscious throughout the entire 2 weeks of treatment, then every decision the medical team had made was not just wrong, but potentially criminal. The medications they had administered, the procedures they had performed, the conversations they had conducted about ending life support, all of it had been done to a conscious, aware patient who could hear and understand everything, but couldn't respond. This proves nothing conclusive, she said desperately, her voice tight with fear. Patients in vegetative states can exhibit responsive movements. Random neural firing can create the appearance of purposeful action. It doesn't necessarily indicate higher brain function or conscious awareness. Nyla opened her textbook to another carefully marked page, her movements deliberate and confident. Dr. Sterling, would you be willing to test David's cognitive function directly? What do you mean? Ask him mathematical questions, problems that require actual thinking, not just reflexive responses. If he can answer correctly by using finger movements, one tap for numbers or specific patterns, it will prove he's not only conscious, but cognitively intact. Dr. Sterling found herself trapped in a corner of her own making. If she refused to test David's cognitive abilities, she would appear to be avoiding evidence that contradicted her diagnosis. If she agreed to test and David failed to demonstrate awareness, she could discredit Nyla completely and restore her medical authority. But if she agreed to test and David successfully demonstrated cognitive function, her entire career would be called into question. Fine, she said, her voice tight with tension and barely contained fear. But when this test fails to show meaningful cognitive response, I want this child removed from my hospital immediately and permanently. Nyla nodded without hesitation. And if the test proves that David is cognitively intact and fully conscious? Dr. Sterling met her gaze, her jaw set with the desperate determination of someone whose entire professional identity was hanging in the balance. "Then I'll immediately implement whatever treatment protocol you recommend, regardless of how it contradicts everything my team and I have believed about this case." The neurological ICU fell into a silence so profound that the mechanical sounds of life support equipment seemed to echo off the walls. Dr. Sterling approached David's bedside, her hands visibly trembling as she prepared to conduct a test that would either validate her medical expertise or destroy everything she had built her career upon. "David," Dr. Sterling said, her voice formal and clinical, "if you can hear and understand what I'm saying, I'm going to ask you some questions. Tap your right index finger once for no and twice for yes. Do you understand these instructions?" 2 clear, deliberate taps. Sarah Wilson gripped her sister's hand so tightly that her knuckles went white. Around the room, medical professionals who had spent decades studying consciousness found themselves witnessing something that challenged every assumption they had made about David's condition. "David," Dr. Sterling continued, her voice growing more strained with each word, "are you 16 years old?" 2 taps. "Are you in a hospital right now?" 2 taps. Dr. Sterling's hands were shaking noticeably now. These responses could still be coincidental, reflexive, or somehow prompted, but the consistent pattern was becoming impossible to ignore or explain away. "David, I'm going to ask you a mathematical question that requires actual thinking. What is 9 plus 7? If the answer is 16, tap twice. If the answer is not 16, tap once." The pause seemed to last forever. The entire room held its breath as they waited for a response that would either confirm or destroy 2 weeks of medical treatment. Then, clearly and deliberately, David tapped twice. Dr. Muller let out a small gasp of shock. Dr. Hayes stepped closer to the bed, his face a mask of professional disbelief. Dr. Morrison was frantically taking notes, documenting responses that contradicted everything they had been taught about brain death and consciousness. "One more question," Dr. Sterling said, her voice barely above a whisper. "David, what season were you born in? If you were born in summer, tap twice. If you were born in any other season, tap once." Nyla watched Dr. Sterling's face carefully as she asked the question, recognizing that this was a strategic test. The doctor was checking not just David's cognitive function, but whether his responses were somehow being coached or manipulated. David tapped once. "He was born in March," Sarah Wilson whispered, tears streaming down her face. "Spring, March 15th. Dr. Sterling staggered backward, her face completely drained of color. The implications were staggering and undeniable. Not only was David conscious and aware, but he was cognitively intact, able to process complex information, and had been listening to every conversation about his condition for the past 2 weeks, including every discussion about how hopeless his case was, how expensive his care had become, and how it might be more humane to end his life support. Nyla stepped forward, her voice gentle but firm. "Dr. Sterling, David has been trapped inside his own body while your team discussed ending his life. He's heard every word about how his condition is incurable, how his care is becoming financially burdensome, how his family should consider letting him die peacefully." The words hit Dr. Sterling like physical blows. In her 25-year career, she had never faced the possibility that she had been psychologically torturing a conscious patient with clinical discussions about their hopeless prognosis. "David," Nyla continued, "can you forgive these doctors for not understanding your condition? They made a mistake, but they were trying to help you. Can you forgive them?" The room held its collective breath. After everything David had endured, after 2 weeks of being treated as an unconscious object rather than a conscious person, his response would be the ultimate test of grace and humanity. David tapped twice. "Doctor." Sterling broke down completely, tears streaming down her face as the full weight of her diagnostic failure became clear. She had built her entire career on the assumption that medical expertise was synonymous with expensive education and institutional authority. But a homeless 12-year-old with a damaged textbook had demonstrated more diagnostic insight than her entire team of international specialists. "What's the treatment?" she whispered, her voice broken by the realization of how catastrophically wrong she had been. Nyla opened her textbook to a detailed treatment protocol she had memorized from multiple medical sources. Immediate discontinuation of all sedative medications that have been suppressing his neural recovery. Anti-inflammatory drugs to reduce brainstem inflammation. Specific neural stimulation exercises to re-establish normal communication pathways. And most importantly, treating David as a conscious patient who can understand and participate in his own recovery. The transformation in David's room was immediate and profound. As Dr. Sterling ordered the nursing staff to discontinue the sedative medications that had been keeping David in artificial neurological suppression, the changes became visible on every monitor in the room. What happened next would not only save David's life but change the practice of medicine at Presbyterian Medical Center forever. Within minutes of Nyla explaining the correct treatment protocol, Dr. Sterling had ordered the nursing staff to discontinue the sedative medications that had been keeping David in artificial neurological suppression. As the drugs began to clear from his system, the changes became visible on every monitor in the room. His EEG patterns are normalizing, Dr. Mueller announced, her voice filled with wonder as she watched brainwave activity that had been suppressed for 2 weeks suddenly show clear signs of conscious awareness. Theta waves are stabilizing into coherent patterns, and we're seeing alpha wave activity consistent with relaxed but aware consciousness. Nyla knelt beside David's bed, her voice gentle but urgent. David, the medicine that was making it hard for your brain to communicate is being stopped right now. You might start feeling more aware, more able to move and respond. Don't be scared if sensations start coming back stronger. That's your nervous system healing itself. Doctor. Sterling watched in stunned silence as Nyla demonstrated the neural stimulation exercises she had learned from her textbook research. Simple but precise techniques. Gentle pressure applied to specific points along David's arms and legs, movements designed to reactivate dormant neural pathways, exercises that encouraged his brain to rebuild connections that had been disrupted by brainstem inflammation. Where did you learn these rehabilitation techniques? Dr. Hayes asked, his earlier skepticism completely replaced by professional curiosity and growing respect. Nyla looked up from her work with David. Dr. Elena Vasquez's research included detailed recovery protocols. She discovered that locked-in syndrome patients recover much faster when treatment begins immediately. But most hospitals don't know about her methods because her work was published in smaller, specialized journals. Why smaller journals? Dr. Morrison asked. Because she was treating homeless patients in free clinics, Nyla replied simply. The medical establishment didn't consider her research relevant to mainstream hospital populations. The irony wasn't lost on anyone in the room. The research that could save David had been dismissed by mainstream medicine because it focused on patients exactly like Nyla, people without insurance, without social status, without the kind of institutional support that gave medical research credibility in academic circles. As Nyla continued the neural stimulation exercises, something remarkable began to happen. David's breathing, which had been mechanically regulated by ventilator settings for 2 weeks, started to show natural variation and rhythm. His heart rate stabilized into patterns consistent with natural rest, rather than medically induced unconsciousness. David, Nyla said softly, I want you to try something for me. Try to wiggle your toes. Don't worry if it doesn't work perfectly. Your brain is just remembering how to control your body again. Sarah Wilson watched her son's feet with desperate intensity. For several seconds, nothing happened. Then slowly, almost imperceptibly, David's right big toe moved. Oh my God, Sarah whispered, her hands covering her mouth in amazement. He moved his toe. He actually moved his toe on command. Doctor. Sterling felt something she hadn't experienced since her earliest days as a medical student. The pure wonder of witnessing healing that seemed miraculous, but was actually the result of proper diagnosis and treatment. For 2 weeks, she had been administering medications that suppressed the exact neural activity David needed to recover. Nyla had identified the problem and provided the solution within 30 minutes of examining him. The anti-inflammatory medication should be administered intravenously, Nyla continued, consulting her carefully written notes. Methylprednisolone, 30 milligrams per kilogram of body weight, followed by a maintenance dose for 10 days. The brainstem inflammation should begin reducing within 6 to 8 hours. Dr. Sterling found herself taking medical orders from a 12-year-old homeless girl, and for the first time in her career, it felt completely appropriate. Nyla understood David's condition better than anyone else in the room because she had lived with the consequences of medical ignorance. Her brother's death had given her a level of knowledge that no medical school could provide. "Nyla," Dr. Sterling said quietly, "what made you come to this hospital today?" Nyla looked up from David, her young face serious. "I've been monitoring hospitals around Philadelphia for 2 years, looking for cases like Ethan's. When I heard about David on the news, a teenage boy in an unexplained coma, I knew I had to try to help." "You've been doing this for 2 years?" "Every day," Nyla confirmed, "looking for patients that doctors have given up on, cases where the symptoms match what I learned studying Ethan's condition." Doctor Sterling realized she was witnessing something unprecedented in medical history. A 12-year-old girl had been conducting her own diagnostic practice on the streets of Philadelphia, using knowledge gained from personal tragedy to save lives that the official medical system had written off as hopeless. And she had been succeeding where they had failed. As the anti-inflammatory medication began to take effect, David's responses became more coordinated and purposeful. His finger movements became stronger and more controlled. Most remarkably, he began to exhibit natural sleep patterns for the first time since his hospitalization. "David," Nyla said, "I'm going to ask you something important. Are you ready to try to open your eyes? It might be difficult at first, but I think you can do it." The room fell silent as everyone focused on David's face. Slowly, with visible effort, his eyelids began to flutter. Then, for the first time in 2 weeks, David Wilson opened his eyes. The moment was electric. Sarah Wilson collapsed into her chair, sobbing with relief. Dr. Sterling felt tears streaming down her face as she realized she was witnessing not just a medical recovery, but the complete vindication of everything Nyla had said about David's condition. "Hi, David," Nyla said softly. "You're going to be okay. We understand what was wrong and you're going to recover completely." David's eyes found Nyla's face, and his lips moved as he tried to speak. No sound came out yet, but his mouth clearly formed the word "thank you." Dr. Sterling knew that this moment would change everything, not just for David, but for the entire practice of medicine at Presbyterian Medical Center. The question was whether the medical establishment would learn from this experience or try to suppress it. The answer would determine whether other patients like David would receive the life-saving treatment they needed or continue to die from preventable diagnostic errors. Word of David's dramatic improvement spread through Presbyterian Medical Center like wildfire. Within hours, medical staff from other departments began finding excuses to walk past his room, hoping to catch a glimpse of the homeless girl who had accomplished what a $1 million medical team couldn't. Dr. Patricia Morrison, the hospital's chief of staff, arrived at 4 a.m. to witness the situation firsthand. She found Dr. Sterling sitting beside David's bed, carefully monitoring the neural stimulation exercises that Nyla had taught her to perform. "Victoria," Dr. Morrison said quietly, "is it true? Did a homeless child really diagnose locked-in syndrome when your entire team missed it?" Dr. Sterling looked up, her face showing the exhaustion and humility of someone whose fundamental beliefs had been completely shattered. "Not just diagnosed it, Patricia. She's treating it, and it's working better than anything I've seen in 25 years of practice." On the monitors, David's brain activity continued to improve dramatically. The theta wave patterns that had been chaotic and suppressed for 2 weeks were stabilizing into coherent rhythms. His muscle responses were becoming more coordinated with each passing hour. Most remarkably, he had begun to exhibit REM sleep patterns for the first time since his hospitalization. "Where is the girl now?" Dr. Morrison asked. "In the family lounge," Dr. Sterling replied. "She's been awake for 18 hours straight, monitoring David's progress and adjusting the treatment protocol based on his responses." Dr. Morrison found Nyla in the small family lounge, curled up in a chair with her damaged medical textbook open on her lap. Even in sleep, the girl's hand rested protectively on the book that had become her most precious possession. "Excuse me," Dr. Morrison said gently, not wanting to startle her. Nyla woke immediately, her eyes alert despite her exhaustion. "Is David okay? Do the monitors show continued improvement?" Dr. Morrison was struck by the girl's immediate concern for her patient, a level of medical dedication that she rarely saw even in experienced physicians. He's doing very well. His neural responses are continuing to strengthen. Good, Nyla said, relief evident in her voice. The anti-inflammatory medication should reach peak effectiveness within the next few hours. His communication abilities should improve significantly by morning. Doctor. Morrison sat down across from Nyla, studying this remarkable child who had challenged everything Presbyterian Medical Center believed about medical expertise. Nyla, I need to ask you something. How many other cases like David's have you encountered? Nyla was quiet for a moment, then opened her textbook to a section near the back. The pages were covered with handwritten notes documenting dozens of cases. Names, dates, symptoms, hospitals, outcomes. 23 patients in the past 2 years, Nyla said simply. 17 full recoveries, 4 partial recoveries, 2 cases where I arrived too late to help. Dr. Morrison felt her breath catch. You're telling me that you've been successfully treating patients across Philadelphia without anyone knowing? Not treating, Nyla corrected, diagnosing. Once I identify the correct condition, I try to get the information to the medical teams. Sometimes they listen, sometimes they don't. And when they don't listen? Nyla's expression grew sad. People die from treatable conditions because doctors are too proud to consider that their diagnosis might be wrong. Doctor. Morrison realized she was facing a medical phenomenon unlike anything she'd encountered in 30 years of hospital administration. This homeless child had been conducting a shadow medical practice, identifying diagnostic errors and correcting them when possible, all while living on the streets and surviving on whatever charity she could find. Nyla, what would you say if I told you that this hospital wants to offer you a formal position? Medical consultant, with full access to our facilities and resources. Nyla looked surprised. You want to hire me? I want to learn from you, Dr. Morrison said honestly. You've demonstrated diagnostic abilities that our most expensive specialists lack. You understand medicine in ways that medical school doesn't teach. Nyla considered this for a moment, then shook her head. I appreciate the offer, but there are too many patients in other hospitals who need help. I can't stay in one place when there are people dying from mistakes that could be prevented. Dr. Morrison found herself face to face with a level of medical dedication that put her entire professional staff to shame. This 12-year-old girl had turned her personal tragedy into a mission to save lives, and she was unwilling to compromise that mission for comfort or security. Then what would you say to a partnership? Dr. Morrison asked. Presbyterian Medical Center could sponsor your work citywide, give you resources, credentials, official support. For the first time since Dr. Morrison had met her, Nyla smiled. Now that, she said, sounds like something Ethan would have wanted. Meanwhile, the confrontation that had been building for hours finally erupted when Dr. Sterling could no longer contain her professional shame and personal revelation. She found herself alone with her assembled team in the hospital's main conference room, staring at the faces of colleagues who had supported her diagnosis with complete confidence. We need to discuss what happened today, Dr. Sterling said, her voice tight with emotion. We need to understand how we could have been so catastrophically wrong about David's condition. Dr. Hayes shifted uncomfortably in his chair. Victoria, we followed established protocols. We ran every test known to modern medicine. We consulted with the best specialists available. And we nearly killed a conscious patient, Dr. Sterling replied sharply. We spent 2 weeks administering medications that suppressed his recovery while discussing end-of-life options in front of him. We failed so completely that a homeless 12-year-old had to correct our diagnosis. That's not entirely fair, Dr. Mueller protested. Locked-in syndrome is notoriously difficult to diagnose, especially atypical presentations, and we had no way of knowing. We had every way of knowing, Dr. Sterling interrupted. The symptoms were there, the EEG patterns were consistent. The nursing staff reported responses that we dismissed. We ignored evidence because it didn't fit our preconceptions. Dr. Morrison spoke quietly. What's done is done. The question is what we do now. Dr. Sterling looked around the table at her colleagues, seeing them with new clarity. We admit our mistake. We change our protocols. We learn from this experience instead of trying to suppress it. You're talking about admitting diagnostic malpractice, Dr. Hayes said nervously. The legal implications alone. The legal implications of continuing to practice medicine the way we've been practicing it are far worse, Dr. Sterling replied. How many other patients have we misdiagnosed? How many families have we put through unnecessary suffering because we were too proud to consider alternative possibilities? If you think hospitals should listen to patients and families, even when they don't have medical degrees, let us know what country and city you're watching from in the comments below. The room fell silent as the full implications of the day's events settled over the medical team. They had been forced to confront the possibility that their expensive education and prestigious credentials were not guarantees of diagnostic accuracy, and that medical insight could come from unexpected sources. The question was whether they would learn from this experience or find ways to rationalize it away. The reckoning came swiftly and decisively. By 2 p.m. the following day, less than 36 hours after Nyla had first appeared in the ICU, Presbyterian Medical Center's Board of Directors had convened an emergency meeting to address what hospital attorney Michael Thompson was calling the most significant diagnostic failure in the institution's history. Dr. Victoria Sterling sat alone in the boardroom's waiting area, her 25-year career hanging in the balance. Through the glass doors, she could hear fragments of heated discussion about liability, malpractice exposure, and institutional credibility. Her name was mentioned repeatedly, not with the respect she had grown accustomed to, but with the kind of clinical detachment typically reserved for discussing problematic cases. Dr. Sterling, the board chairman, Robert Wilson, no relation to David, called her into the meeting. We need to understand exactly what happened with the Wilson case. Dr. Sterling faced 14 board members, colleagues she had worked with for years, now looking at her with expressions ranging from disappointment to barely contained anger. She realized that this was how patients must feel when medical professionals discussed their cases, reduced to a problem to be managed rather than treated as a person deserving dignity. The facts are straightforward, she began, her voice steady despite her inner turmoil. My team and I misdiagnosed David Wilson's condition, leading to 2 weeks of treatment that suppressed rather than supported his recovery. A 12-year-old homeless girl identified the correct diagnosis within 30 minutes of examining him. And the financial implications? Asked the hospital's chief financial officer. We charged the family $547,000 for treatment that was not only ineffective, but actively harmful, Dr. Sterling admitted. Nyla Carter provided the correct diagnosis and treatment protocol at no cost and asked for nothing in return. The room fell silent as the board members absorbed the magnitude of the institutional failure. Presbyterian Medical Center's reputation was built on providing the highest level of medical care available anywhere in the world. They attracted the most brilliant minds, charged premium prices, and delivered results that justified their astronomical costs. The Wilson case suggested that their most expensive specialists were not just inferior to a homeless child's diagnostic abilities, but potentially dangerous. Dr. Sterling, Chairman Wilson said finally, given the severity of this diagnostic failure and its implications for patient safety, the board has decided to request your resignation, effective immediately. Dr. Sterling had expected this outcome, but hearing it spoken aloud still felt like a physical blow. I understand, she said quietly, but before I leave, I want to make several recommendations. What kind of recommendations? First, hire Nyla Carter as a diagnostic consultant. Give her credentials, resources, and authority to review cases where traditional approaches have failed. Her insights could revolutionize how this hospital practices medicine. Board member Dr. Sarah Chen leaned forward. You're suggesting we hire a homeless child to supervise our medical staff. I'm suggesting you hire someone who understands medicine in ways that medical school doesn't teach, Dr. Sterling replied. Nyla has successfully diagnosed 23 cases that other doctors missed. Her methodology could save lives and prevent exactly the kind of institutional failure that we're dealing with today. Chairman Wilson made notes on his tablet. And your other recommendations? Doctor. Sterling took a deep breath before making the most important suggestion of her career. Refund the Wilson family's entire treatment cost. Publicly acknowledge our diagnostic failure. Use this case as an opportunity to demonstrate that Presbyterian Medical Center values patient care over institutional pride. That would cost over $500,000 and potentially expose us to malpractice litigation. Continuing to practice medicine the way we've been practicing it will cost us much more, Dr. Sterling said firmly. Nyla Carter showed us that our expensive specialists can be catastrophically wrong. Either we learn from that revelation, or we pretend it didn't happen and wait for the next diagnostic failure to destroy more lives. The board voted unanimously to accept Dr. Sterling's resignation, but they also voted, by a margin of 9-5, to implement her recommendations regarding Nyla Carter and the Wilson family financial restitution. As Dr. Sterling cleaned out her office that afternoon, she felt something she hadn't experienced in years, the satisfaction of having done the right thing, even when it cost her everything she had built her professional life around. Nyla Carter, meanwhile, was about to discover that sometimes losing everything is the first step toward finding what you are meant to do. 3 days later, Presbyterian Medical Center unveiled the Nyla Carter Diagnostic Protocol, a revolutionary approach to medical consultation that would fundamentally change how the institution approached complex cases. The protocol required that for any patient who had been unresponsive to treatment for more than 72 hours, a multidisciplinary team would review the case from first principles, specifically including perspectives from non-traditional medical backgrounds. Dr. Patricia Morrison stood before a packed auditorium of medical professionals, journalists, and hospital administrators from around the country to announce the new program. Behind her, a large screen displayed statistics that had shocked even her. In the 3 days since Nyla had begun consulting at Presbyterian, she had identified diagnostic errors in 7 cases, leading to successful treatment of patients who had previously been considered hopeless. The Nyla Carter Protocol, Dr. Morrison explained, is based on a simple but revolutionary premise. Medical expertise can come from sources beyond traditional medical education. Our new diagnostic team includes individuals who have studied medicine from personal necessity, who understand patient experience from having lived through misdiagnosis, and who approach symptoms without the preconceptions that sometimes blind formally trained physicians. In the front row, Nyla sat beside David Wilson, both of them wearing the uncomfortable formal clothes that the hospital's public relations department had insisted upon for the announcement. Nyla clutched a new medical textbook, a gift from the hospital's medical library, but David noticed she still carried her original torn and taped book in her backpack. The financial implications of this program are significant, Dr. Morrison continued. In 3 days, we've prevented an estimated $1.8 million in unnecessary treatments and reduced average diagnostic time for complex cases by 70%. But more importantly, we've identified and corrected medical approaches that were actively harming patients. The audience stirred with interest. Hospital administrators were always concerned about liability and cost control, but the suggestion that diagnostic errors were so common that a systematic review could prevent millions in wasteful spending was both encouraging and disturbing. The Nyla Carter Protocol also includes a patient advocacy component, Dr. Morrison announced. Every patient in our ICU now has access to a diagnostic review team that includes individuals who have personal experience with misdiagnosis. This team is empowered to challenge medical decisions and request alternative approaches when traditional treatments are failing. Nurse Jennifer Martinez, who had been promoted to head the new patient advocacy program, stood to address the audience. The most important change we've implemented is cultural. We've created an environment where observations from patients, family members, and non-traditional sources are valued equally with formal medical opinions. This requires humility from our medical staff, but it's already saving lives. Nyla was invited to speak, though she had insisted that her remarks be brief and focused on practical applications rather than personal recognition. She approached the podium with her characteristic quiet confidence, looking out at an audience of medical professionals who represented the same institutional thinking that had failed her brother. 2 years ago, she began, doctors told me that my observations about my brother's condition weren't valuable because I didn't have medical training. Today, those same types of observations are being used to save lives at one of the most prestigious hospitals in the country. She paused, looking directly at several doctors in the audience who were taking notes on her comments. The difference isn't that I learned more about medicine. The difference is that this hospital learned to listen to people who understand suffering, not just people who understand systems. The applause was sustained and genuine, but Nyla raised her hand to continue. The Nyla Carter protocol isn't about me. It's about creating space for knowledge that comes from necessity, from experience, from paying attention to details that formal training sometimes overlooks. She gestured toward David, who smiled encouragingly. David is alive today because someone finally listened to what his body was trying to communicate. How many other patients are waiting for someone to listen to them? The question lingered in the auditorium long after the presentation ended, challenging every medical professional present to reconsider how they approached the fundamental act of healing. 6 months later, the ripple effects of Nyla Carter's intervention at Presbyterian Medical Center had spread far beyond Philadelphia. Medical schools across the country were incorporating Carter protocols into their curricula, courses that taught medical students to value patient observations, family insights, and non-traditional sources of diagnostic information. Nyla herself had become something unprecedented in medical history, a credentialed diagnostic consultant who had never attended medical school. The American Medical Association had created a special certification category for individuals who demonstrated exceptional diagnostic abilities through practical application rather than formal education. Nyla was the first person to receive this certification, but she wouldn't be the last. She had moved into a small apartment near Presbyterian Medical Center, but she still spent most of her nights walking through Philadelphia's homeless communities, carrying her medical textbooks and offering informal consultations to people who couldn't afford traditional health care. The difference now was that she had institutional support. Presbyterian Medical Center provided her with basic medical supplies and had established a fund to cover emergency treatment for the patients she identified. Nyla, Dr. Morrison said during one of their weekly meetings, "The board has approved funding for a national program. We want to establish Carter protocols in 50 major hospitals across the country. Are you ready for that level of responsibility?" Nyla looked up from the case file she was reviewing, 6 patients from other hospitals whose families had contacted Presbyterian specifically requesting her consultation. "Dr. Morrison, I've been ready for this responsibility since the night Ethan died. The question is whether the medical establishment is ready to admit that healing requires more than credentials." David Wilson had become Nyla's most effective advocate. His recovery had been complete, but his experience as a conscious patient trapped in an unresponsive body had given him insights into medical care that he was determined to share. He had started a foundation called Ethan's Voice that connected families dealing with misdiagnosis to resources and advocates who could help them navigate medical systems. The hardest part, David often told audiences at medical conferences, wasn't being unable to move or speak. The hardest part was listening to doctors discuss my hopeless case when I knew I wasn't hopeless. Nyla gave me my voice back, but more importantly, she taught the medical system to listen. Dr. Victoria Sterling had found her own path to redemption. After leaving Presbyterian, she had joined a free clinic in North Philadelphia, where she worked alongside Nyla to provide medical care to homeless populations. The experience had stripped away her professional arrogance and reconnected her with the reasons she had originally become a doctor. "Working with Nyla taught me that I had been practicing medicine backward," she reflected during a documentary interview about the case. "I had been trying to fit patients into diagnostic categories instead of listening to what each patient was trying to tell me about their unique experience." The documentary, titled "Listening: The Nyla Carter Story," had won a Peabody Award and sparked nationwide conversations about medical education, diagnostic accuracy, and the relationship between institutional authority and actual expertise. But Nyla's most important legacy wasn't the protocols, the certifications, or the national recognition. It was the simple practice of paying attention to patients, to families, to the details that formal training sometimes overlooked. Late at night, when Nyla walked through the homeless camps beneath Philadelphia's bridges, she still carried Ethan's photograph in her medical textbook. But now she also carried letters from dozens of patients whose lives had been saved by the diagnostic approaches that grief had taught her. "I kept my promise, Ethan," she whispered to his photograph on the anniversary of his death. "No one else will die from the mistakes that killed you, not if I can help it." Above her, the lights of Presbyterian Medical Center glowed against the night sky, a symbol of institutional medicine that had learned to listen. And in the ICU, another patient was receiving care from doctors who understood that sometimes the most important medical knowledge comes not from textbooks, but from the simple act of remembering that healing begins with hearing what patients are trying to say. 2 years after Nyla Carter had first burst through the doors of Presbyterian Medical Center, the transformation she had initiated had become a permanent part of American medicine. The Carter protocols were now standard practice in over 200 hospitals nationwide, and medical schools had made patient-centered diagnostic approaches a required course for graduation. But for Nyla, the real victory wasn't institutional. It was personal. She stood in the same ICU where she had first met David, now serving as chief diagnostic consultant, watching a team of doctors implement the protocols she had developed. The patient was a 14-year-old girl named Maria Santos, who had been unresponsive for 10 days after a car accident. Traditional testing suggested severe brain damage, but the nursing staff had reported subtle responses that the monitors weren't detecting. The EEG patterns are showing the same theta wave fluctuations we saw in David's case, Dr. Jennifer Martinez reported. She had been promoted to head of the diagnostic review team after completing specialized training in non-traditional assessment methods. And the family's observations? Nyla asked. The mother insists that Maria's breathing changes when she hears certain music. The father says her heart rate increases when he talks about school. The younger brother claims she moves her fingers when he tells her jokes. Nyla nodded, making notes in a tablet that had replaced her damaged textbook, though she still kept the original book in her office as a reminder of how far she had come. Classic signs of atypical locked-in syndrome. Let's run the Carter protocol diagnostic sequence. The team moved with practiced efficiency, implementing the assessment techniques that had been refined through dozens of successful cases. Within 2 hours, they had confirmed that Maria was conscious and cognitively intact, trapped in a body that couldn't respond normally to her mental commands. Treatment protocol? Dr. Martinez asked. Standard anti-inflammatory regimen, neural stimulation exercises, and immediate family integration into the recovery process, Nyla replied. Maria should be communicating within 48 hours. As the team began implementing the treatment plan, Nyla allowed herself a moment of satisfaction. 2 years ago, Maria would have been written off as hopeless. Her family's observations would have been dismissed as wishful thinking. She would have become another victim of medical arrogance and institutional blindness. Now Maria would recover completely and return to her family, her future intact, because a homeless girl had refused to let her brother's death be meaningless. That evening, as Nyla finished her rounds and prepared to leave Presbyterian Medical Center, she received a call that would mark the most important moment of her young career. Nyla, this is Dr. Sarah Chen from the National Institutes of Health, the voice on the phone said. We've been following your work with great interest. The President's Medical Advisory Committee wants to meet with you about implementing the Carter protocols in every hospital that receives federal funding. Nyla paused in the hospital lobby, looking up at the wall where a large plaque now read, "In memory of Ethan Carter and all patients whose voices were not heard, their suffering teaches us to listen." Dr. Chen, Nyla replied, "I'd be honored to help, but I have one condition." "What's that?" "Any hospital that implements the Carter protocols must also establish free diagnostic services for homeless populations. Medical expertise shouldn't depend on the ability to pay, and the people who need help most are often the ones whose voices are ignored." "Agreed," Dr. Chen said immediately. "When can you come to Washington?" As Nyla hung up the phone, she felt Ethan's presence more strongly than she had since the night he died. Her brother's tragedy had become the foundation for a medical revolution that would save thousands of lives. David Wilson approached her in the lobby, now a pre-med student at the University of Pennsylvania and one of Nyla's most dedicated advocates. "How did the Santos case go?" he asked. "She'll be talking with her family by Thursday," Nyla replied with a smile. Another voice restored, another family saved from unnecessary grief. David nodded, understanding the deeper meaning. Ethan would be proud. "I think he is," Nyla said, looking once more at the memorial plaque. "I think he finally knows that his story mattered." Outside Presbyterian Medical Center, the city of Philadelphia stretched out under the evening sky. In homeless camps beneath bridges, in free clinics serving the forgotten, in emergency rooms where the desperate sought help, people who had been written off by the medical establishment now had hope. Because a 12-year-old girl had turned her grief into purpose, her loss into learning, her brother's death into a legacy that would save lives for generations to come. The Carter Protocols had proven that medical knowledge could come from unexpected sources, that healing required listening as much as learning, and that sometimes the most important truths are spoken by those whom society chooses not to hear. As Nyla walked home through the streets where she had once lived, she carried with her the satisfaction of a promise kept and a mission fulfilled. Ethan's voice had been silenced by medical ignorance, but through her work, it would speak forever in the protocols that ensured no other patient would suffer in silent desperation. The homeless girl with dirt under her fingernails had not only diagnosed what million-dollar doctors couldn't, she had transformed the very foundation of American medicine. And in hospitals across the nation, patients like David and Maria would live because someone had finally learned to listen. 5 years after Nyla Carter had first sprinted through Presbyterian Medical Center's lobby, she stood before the United States Congress, testifying in support of the National Patient Advocacy Act, legislation that would make the Carter Protocols mandatory in every hospital receiving federal funding. "Members of Congress," she began, her voice steady and confident. "5 years ago, my brother Ethan died from a treatable condition because doctors wouldn't listen to a 10-year-old girl's observations about his symptoms. Today, the protocols developed from that tragedy have saved over 10,000 lives and prevented millions of dollars in unnecessary medical costs." She paused, looking directly at the legislators who would decide whether her brother's legacy would become the law of the land. The Carter Protocols have proven that medical expertise can come from unexpected sources, that diagnostic accuracy improves when we value all observations regardless of their source, and that the best medicine happens when we remember that patients are people, not just cases to be solved. The National Patient Advocacy Act, passed by overwhelming majorities in both houses of Congress, and was signed into law 6 months later. Every hospital in America now operates under protocols that began with a homeless girl's determination to ensure that no other family would endure what she and Ethan had suffered. Victoria Sterling, now directing the National Center for Diagnostic Innovation, often reflects on how profoundly her understanding of medicine changed because of a 12-year-old's courage to challenge authority. "Nyla taught me that the most dangerous words in medicine are, 'We've always done it this way,'" Dr. Sterling says. "Real healing begins when we admit that we don't know everything and open ourselves to learning from anyone who can help us understand suffering." David Wilson graduated from medical school with the highest honors in his class and now works alongside Nyla at the Carter Institute for Medical Innovation, where they train doctors from around the world in patient-centered diagnostic approaches. "The hardest part about my experience," David often tells medical students, "wasn't being trapped in my own body. It was knowing that the people responsible for saving my life had given up on me." Nyla gave me back my voice, but more importantly, she gave medicine back its soul. Today, Nyla Carter is recognized as one of the most influential medical innovators of the 21st century. She has received honorary doctorates from Harvard, Johns Hopkins, Stanford, and Yale, the same institutions whose graduates once dismissed her observations. But she still carries Ethan's photograph in her medical textbook, and she still spends her nights providing free medical consultations to Philadelphia's homeless population. "Success isn't measured by the recognition you receive," Nyla says. "It's measured by the voices you help restore, the suffering you prevent, and the promises you keep to those who can no longer speak for themselves." The Carter Protocols have been implemented in over 40 countries and have fundamentally changed how medicine is practiced worldwide. Medical schools now teach courses in diagnostic humility and patient observation techniques. Hospitals have patient advocacy teams that include individuals with personal experience of misdiagnosis. And most importantly, the medical establishment has learned to listen. But perhaps the most fitting tribute to Nyla's work came from an unexpected source, a letter from Maria Santos, the 14-year-old girl whose life Nyla had saved during her early days as a consultant. "Dear Dr. Carter," the letter read, "I'm writing to tell you that I just started medical school. I want to learn everything I can about locked-in syndrome and diagnostic medicine so that I can help other patients the way you helped me. I want to be a doctor who listens, just like you taught everyone at Presbyterian to listen. Thank you for giving me back my voice and showing me how to use it to help others." That letter now hangs in Nyla's office, next to Ethan's photograph and the original damaged textbook that started her journey from grief to purpose. Late at night, when Nyla finishes her work and prepares to leave the Carter Institute, she sometimes pauses at Ethan's memorial plaque in the lobby. The inscription reads, "Ethan Carter. His voice was silenced, but his story speaks forever. I kept my promise, big brother," she whispers. "No one else will die from the mistakes that took you from us. Your voice is heard in every hospital, in every protocol, in every life we save. You're still here, Ethan. You're still making a difference." Above her, the lights of medical centers across Philadelphia glow against the night sky, symbols of an institution that learned to value wisdom over credentials, listening over lecturing, and healing over pride. And in ICUs around the world, patients who might once have been abandoned as hopeless now receive care from doctors who understand that sometimes the most important medical knowledge comes not from textbooks, but from the simple recognition that every patient has a story worth hearing. The homeless girl with dirt under her fingernails had not only saved David's life, she had saved the soul of medicine itself. Thank you to everyone who typed hope and to all who shared their locations from around the world. Your global support means everything. If these stories inspire you, please subscribe to join our community and help us share more incredible tales of courage and justice. Until next time, keep believing in the power of truth.